Duodenum is the first part of the digestive system. So the duodenum attaches to the stomach. There is a valve or a sphincter that's located between the stomach and the small intestine. Tell me what that sphincter is. Look it up. Sphincter between the stomach and small intestine. Look it up, look it up, look it up.
Where's that image? The more up. Say that word.
Pyloric?
Pyloric sphincter. Okay, so let's start all over again. Mouth, esophagus, stomach, pyloric sphincter. What's the first part of the small intestine again? Duodenum, jejunum, ileum, and then what's the valve between the small intestine and large intestine? Look it up. Sphincter.
Junction. I don't know.
Oh, yeah.
Say that word. Ileocecal junction.
Ileocecal junction.
Ileocecal junction.
Ileocecal junction. All right. Then it goes to the ascending colon, transverse colon, descending colon, sigmoid colon, which is at an angle, rectum, anus. Where is the appendix in all of this? Ooh.
It's on your left. It's on.
What part of the intestine is it attached to? Huh? You betting your life on it? Ileum? And which part of the ileum is part of the small intestine? Beginning, middle, or end?
The end.
End. Okay.
Small intestine.
All right. So what else does the digestive system do besides absorb nutrients?
Get rid
Okay.
of waste.
Get rid of water, absorbs water, and in the process of absorbing the water, we're making the waste products, right? Okay. All right. What's next? Nervous system. Fundamental aspect of the nervous system, all called neurons. That's the fundamental cell of the nervous system. The nervous system is broken down into two different systems. What are they? No. Central nervous system and peripheral nervous system. Remember, we did the little diagram?
Yeah.
You want to do the diagram again?
Yeah.
All right. Nervous system.
Go for it. Very good.
Broken down into two categories. Central, right? CNS, which is what?
Brainstem.
Brain and spinal.
Brainstem?
I
No,
don't know.
it's part of it. Brain and spinal cord.
I was right.
And what's the other one? Peripheral. And the peripheral is broken down into two categories. What are they?
Sympathetic.
Okay. Somatic is what?
Regulates activities, voluntary.
We control.
Yeah, voluntary.
Okay, voluntary.
Okay. I got it.
And then we have the what?
Involuntary.
Autonomic.
Involuntary.
Your heart, lung.
And it's broken down into two categories.
Sympathetic and parasympathetic.
And the neurotransmitters for sympathetic.
Epi and norepi.
Okay. What's it for the parasympathetic?
Acetylcholine.
Okay. All right. While we're doing this, we need to talk about the correlation between the nervous system and the hypothalamus. The hypothalamus actually regulates the endocrine system. And how did I correlate the endocrine system with the nervous system? You remember how I correlated it? What does the nervous system do to the what does it function? It's what messengers? Chemical messengers. Okay? Okay? So the hypothalamus controls the endocrine system. Specifically, we're talking about the pituitary gland. And the pituitary gland used to be called the master gland because they used to think that it controlled everything. But we found out see this little egg-shaped thing right here? That's the pituitary gland. And it's called the master gland. It controls all other glands. It's right here, number 46.
Granddad.
That's the pituitary gland. Okay? It's the pituitary gland. See? This is a little egg thing. It's pituitary gland.
Oh.
So if you had a pituitary tumor, that'd be a little mother to get to, wouldn't it?
Rip his whole fucking head off.
Well, if you think that's
You
tiny,
can't shake your head. Just
wait till I show you the pineal gland. The pineal gland are the two little white things that are behind it. Number 84. See how teeny tiny those are? The pineal gland is what regulates your sleep. Teeny
Wow.
That shit must be
See these
shot.
little white things right there underneath the
Fucking
pituitary
destroyed all fucking black and shit.
Huh?
The sleeping gland.
Pituitary.
Sleeping gland?
Yeah, that shit's fucking ruined.
Yeah, mine fell out.
Good Lord.
Probably have a fucking spasm each time you wake up.
That's your pineal gland. How tiny it is?
Mel, I'd say that's about average size. Hey, love it.
I got your pituitary gland.
Oh, the little ass thing?
Yeah.
Damn.
That's your pineal gland. What's your pineal gland do?
Regulate sleep.
Regulate sleep through the process of processing melatonin. Tiny little lady, before you see it. Didn't you see it? Oh, yeah. Okay. This is my pituitary gland. I got it. Could you grab my other cerebellum, please? All right. So the pituitary gland, master gland. What controls the pituitary gland? I forgot.
The endocrine system, which is also controlled by the hypothalamus.
Rawson! Don't want to listen to Rawson.
Hypothalamus.
Hypothalamus controls the pituitary gland.
Thalamus.
Okay. All right. Tell me about the endocrine system, about the hormones. I forgot again.
Just secreted chemically messenger.
They're chemical messengers of the nervous system that do what? Throughout? What's the difference between an endocrine gland and an exocrine gland? I forgot.
Endocrine is around the body, exocrine is localized.
Okay. What gland I tell you is both an endocrine and an exocrine gland?
The pancreas.
Pancreas. Yeah.
Y'all are getting there. All right, y'all are getting there. I'll switch back. All right. So, kind of the chemical side and electrical side. There's two parts of the nervous system. There's the chemical side and there's the electrical side. They work together to maintain.
Homeostasis.
Man, y'all are getting there.
Yes, sir. I'm dying in this bit.
All right. So, what did I say? The fundamental or the base cell of the
The neuron.
neuron, right? All right. The neurons are broken down into axons and dendrites. AXONS are axons, and dendrites, DENDRITES, dendrites are the other part of a neuron. And the way that you remember it is axons, send the message away. So they send the electrical message away. Dendrites have finger-like projections everywhere, and they receive the message. So axons send the message away. Dendrites receive the message. Okay? So, Hayden, you're ironing your shirt this morning, and all of a sudden you inadvertently touch the hot-ass iron. Tell me what happens.
I get a burn on my fingers.
All right, how quickly do you pull your finger off?
Pretty much instantaneously.
Right. So let's think about what happens down at the cellular level. So way down in your dermis, you have a nerve ending. And at the microscopic level, you have neurons. And the neurons at the basic level is that they have axons and dendrites. So what specifically is receiving that information? That shit is freaking hot. The dendrites.
Yeah, because
It moves it to the axons all the way up your arm, all the way up to the brain, and the brain says, holy shit, that's hot. It sends another message all the way back down your arm saying, move that shit, and you pull it away. And then your brain goes, you're a dumbass, because you just touched a hot iron. All right? But that's how quick it works. It's pretty amazing how quick it works. All right? So, we talked about the meninges before. What are the meninges?
That.
Dura, arachnoid, and pum. What do they do specifically? Around the
Like-
brain.
Like
Okay.
protection.
And? Okay. All right. The main part of the brain is called the what? Cerebrum, right? Put my brain back together. Drugs.
Wait,
All right.
I won't. Thanks, man. Not even crack or cocaine.
Takes me a second to put my brain back together.
It's very complex, you know.
It is. It
is.
Shit.
If you drop your cerebellum,
Cerebrum. Drop the cerebrum. I gotta put it in here.
Never mind. I'll shut my dumb ass up. I can't say words, man. Cerebellum. Is that what you said? Cerebellum. Cerebellum.
Yeah, so it's called the hemisphere. So right brain, everything on your left side of your body is controlled by your right brain. Everything on your left side of your body is controlling what?
The left.
Okay? So when you arrive on scene to somebody who's having right-sided flaccidness or paralysis from an ischemic stroke, what side of the brain is affected?
Left side. I can put it back together if you know.
Well, then, what are you doing?
Now I got a question.
I have somewhat of an answer. Forget that one's certain.
What's your question?
I don't know, should I ask now or should I ask
It's fast.
later?
Yeah.
So we were in a call a couple shifts.
Like what?
We were in a call a couple shifts ago, and the paramedics pretty much thought that the guy had pretty much stroked out a couple days ago. He pretty much went not unresponsive, but just like his entire normal just pretty much changed, and the family waited multiple days to even call it in. Other than pretty much taking his airway, is there anything we could do from a standpoint because his pupils were all pretty much dilated, and he was not even really responsive. Like he was moving around, like blood pressure was normal. Kind of.
What was his Glasgow? If you say the word about, I'm coming across the table.
I would probably say
It is.
I
All right. What is it? Is it eyes opening?
Yeah.
Okay. Do you have any verbal response?
No.
Okay, so that's a 1, and you got 4 for eye opening. That's a 5. What was his motor response?
probably like a 6 or so. Probably a 6. I would go with the 6.
So he was posturing,
He was coordinated. In fact, he wasn't like.
would he was withdraw from pain? If you
No,
pinched the shit out of him, would he pull back from pain? Did y'all assess it?
I didn't. I was more worried about like getting him on the stretcher and then driving to the hospital.
Oh. So did he need to be intubated?
Yes, but we were 5 minutes away from the hospital. They were trying to obtain IV access.
All right.
Prior.
This is a great teaching moment for you guys. Okay? All right. Let me see where I want to be.
So we were 5 minutes away from the hospital. They were trying to obtain IV access. And
What's more important, airway or IV?
Airway. Oh shit! You got
But it wasn't like necessarily like.
All right, I'm going to give you a
any sort of
hypothetical.
stress.
I'm going to give you a hypothetical, okay? And I'm going to go over this when we get into med legal.
You know, the
Right.
RSIM first with IVs to get a.
Let's see. Where can we be? Everybody knows where the Avid Hotel is, right there on 17th Street and Pine, right?
Yes.
Yeah, it's right there on 7th. Emily, you know where 17th Street and Pine is? If you picked up a rock from that intersection and you threw it, you probably could hit Advent's parking lot.
Okay.
Okay?
Yeah.
So we're talking about a block and a half away. You arrive on scene to Avid Hotel for your patient
Oh.
that you're just describing. Glasgow Coma score is less than 8. Okay? And you say to yourself, you're the paramedic, and you say, Avid's just right over there. Just put an urethral on it going over to the hospital. Okay? Probably 95+% of the time, you're going to be absolutely okay. But the 5% that patient, by moving him, moving her, whatever, vomits and aspirates, and then dies 3 days later from aspiration pneumonia, and that could have been prevented because it doesn't say you should. It says Glasgow Coma score less than 8. We do what?
Intubate.
This is a problem, and it's happening all over. And the rationale is always, well, we're only 5 minutes away from the hospital. When you have an airway issue, the clock stops. Period. End of story. Okay? And I can tell you, because I've testified in multiple cases, that I'll win every single time. I'll win every single time. So do you take that 95% chance of the patient being okay and just running over to the hospital, or are you going to be a clinician, intubate the patient, RSI the patient, get control of the airway, and walk into the ER like a rock star? Because that is what the standard of care says to do. So why are we not doing that? And y'all know exactly what I'm talking about. Why are we not doing that?
I just have a question.
Laziness? Complacency? Who's teaching everybody to do that? Paramedics with experience, because guess what? They've gotten away with it too. Okay? How do you get good at something?
You do it over and over again.
You got to do it. That's why we're having a problem with airway management. That's why we have paramedics out there that cannot intubate. Okay? If you want to get down to the nitty-gritty fundamental aspect of the problem, we're not doing the procedure. And that's the only way you get good at it. All right? Hold on a second, Kate. Kate, wait for you.
So when it comes to like when they call it a stroke alert, when we like EMS shows up to the hospital, immediately they get transported to the stroke bed and they get assessed by that doctor there. If you were to RSI and intubate, would you just give them your assessment and basically just say like?
But we have to do a good assessment.
Yeah, it's,
Right. Airway is still paramount, guys.
I've seen their assessments and they take that shit deep.
Oh, yeah.
Inflection, adduction, and all that other stuff.
Oh, yeah. Because they can tell, based on their assessment, if it's a large vessel occlusion or... But it's only going to take them a little bit to do it, and then where are they off? They're off to a CAT scan.
Yeah.
And why do they go to a CAT scan? Why do you strugglers go to a CAT scan immediately?
See where the bleed is or see if it's blocked.
to see if there is a bleed. If it is a bleed, then we're not going to. It's not a. It's a stroke alert, but it's a hemorrhagic stroke.
Yeah.
And we'll break that down in a little bit. Okay. Because the way you manage an ischemic stroke is completely different than the way you manage a hemorrhagic stroke. Okay. Night and day. But does that make sense?
Yeah,
Blake?
But so from a treatment perspective on our end, is there anything else we can do other than intubate?
Mm-mm. Do you know what we used to do for all stroke patients, unless we need to do advanced airway management? It was a non-emergency transport to the hospital.
Oh, really?
There was no treatment. Back in the 90s and early 2000s, there was no treatment for stroke. This is something new. So we would take non-emergent, we could on seeing the patient just had a stroke. Okay, put you on the stretcher, take you to the hospital. Because that's nothing you can do. Okay. So that's part of it. And that's where I get, and I'm still kind of I'm a cowboy when it comes to that. What do kind of cowboys do? They kind of stand up for the right thing. They say what's the right thing to do. And Dr. Fonfelter and I, and the reason why he's so big on these eye gels is why?
They're easy.
They're easy. And they do a halfway decent job. Okay? But I'm telling you, the patient's vomiting, the patient has secretions or blood in their airway, it's not going to seep right. They don't work good. Guess what? Intratracheal intubation solves that problem.
Actually, me and Gabe had a call. We had noticed. I personally noticed for the first time an actual, like how much better an actual tube is versus the eye gel.
Yeah.
Because we saw the lady's stomach. I mean, she was a bigger lady, but went from here, and by the time we're at the hospital, it was huge.
And we had the digest either.
Yeah.
It's kind of
And
limitation.
we should have intubated, but the med didn't want to.
And here's the fundamental aspect of this is that if we keep going on this trend, what's going to happen? The patient's going to go away. This is the thing. Pediatric intubation's already gone away, and it needs to, because your agencies don't value pediatric intubation training. They don't value it. I mean, as far as airway training, talk about everybody in here is Marion County Fire Rescue except for Hayden, right?
Yeah.
How often do y'all practice RSI?
You do some target
Okay.
solutions here and there.
Levy County quarterly. Levy County, you do quarterly RSI in front of the training captain, or the battalion captain, or the medical director.
Jesus.
Quarterly. Why?
You do it.
Because you need to know how to do that procedure. So let's fix the problem first. And it's very interesting because I am kind of I feel like sometimes I'm the lone wolf on this, and because I feel like it's so important, is that you'll see my students, my former students, they're intubating the shit out of people because I'm going to empower you. I'm going to tell you the benefits of doing it. Okay? So I've got one of my former students. She works in Levy County. I think she's been out of paramedic school 3 years now. She's already got 30 or 40 intubations.
Damn.
She's never missed.
Hell yeah.
She's never missed.
That's cool.
Okay? But you're also working in an environment where you get to do that. Where you have long transport times and you see the benefit. Listen, I'm going to tell you right now, okay? There are 2 patients in the entire time frame that I flew for Shansko that I could not intubate. 2. Okay? One was a gunshot wound to the neck from an AR-15. There was nothing identifiable. I couldn't see anything. It was all blood. Okay? And the other one was a patient who had what's called a radical neck. Pretty much he had cancer all in his neck, and most of his neck was gone. So there was no anatomical landmarks for me to see. I couldn't see anything. It was gone. So a King Airway ventilated both those patients. So there's a time and place for it. Okay? So you just have to take it with, what it's there for. So, but it's a good discussion to have, and I like for you guys to hear it from me, because I'm going to tell you is that the eye gels are simple, and the reason why people are going to them is because in 2025 we like the easy way, don't we? You know what the fundamental rationale behind that is? Those damn phones. Everything is just a click away. I want to go on a vacation. Click away. I want to buy something on Amazon. Click away. Everything's easy. So intubating people takes skill, takes some sass, some grit, to do it. But I still think you need a latch. And it's a pride thing for me. It's a pride thing. I mean, when you walk into the emergency room and you have a properly placed endotracheal tube, and then you throw an OG tube in because you're an absolute badass, man, you're a rock star then. I mean, seriously, you're a rock star. Okay. So I think we'll stop there. I want to go over specific neurologic emergencies next class. So we'll talk about ischemic versus hemorrhagic strokes. We'll talk about some other disease process that I really want you to be familiar with. Okay? Yes, ma'am.
Nice catch.
Shit on your ass.
All right, question. Good job on the test. That's kind of what we're going to do.